Hello everyone. This pre-class lecture is broken up into two parts. It is all around interpersonal communication skills, which was that fairly hefty chapter that I assigned for this week that I had strongly recommended that you at least start to dip into last week when we talked about kinesics. So now we're going to focus on giving and receiving feedback, mastering nonverbal communication, which we started getting into last week and will continue this week with kinesics. We're going to talk about employing emotional intelligence, choosing the right type of listening for the situation, using relevant questions and paraphrasing, and understanding conflict and the use of different strategies. So let's get going. As you might have guessed, a lot of this section, which we started last week, is all from the chapter that I started using about a year ago. It just has a lot of really great managerial interpersonal communication strategies, and it's a pretty dense, pretty hefty chapter as part of the HBR reads. So this is all from gaining insight into the role of interpersonal communication for today's managerial leaders by Deborah Roebuck. So why interpersonal communication in a professional development course? Simply put, interpersonal problems generally lead to restricted communication flow, inaccurate messages, and misinformation, misinterpretation, and a misunderstanding of meaning. Deborah argues that managers confront issues with communication daily. Those of you in the professional healing types of work, you also deal with miscommunication. Again, that relationship between the healthcare provider and the client-patient. So this can be reflected in one respondent who stated, "I think the most common communication problems revolve around a failure to be in sync with each other, generally due to personal and environmental factors that make it difficult to really hear what the other person is saying." So some of the key ideas from your assigned reading is how we give and receive feedback, how we master nonverbal communication to be deliberate and purposeful about what we do and how we do it. Our use of our body in terms of kinesics, how we use emotional self-awareness, awareness of others, conflict, relationship management, self-control, to use those soft skills of emotional intelligence, which is centered around a lot of my own personal work as a researcher. How do we choose and signal the type of listening of how we're engaging with other people? How we use paraphrasing and questions to guide conversations in the right direction and to deflect types of questions that may be not constructive or can be misconstrued or easily misunderstood. And finally, how we manage conflict. So the first thing in this pre-class lecture is let's talk about feedback. So how is delivering a presentation like giving feedback? When we give feedback, we describe behavior, we describe performance, we describe the outcome, the results that we achieve. We try to explain, we try to provide illustrations, we try to make something concrete. We try to communicate, whether it's an employee, whether it's a patient in a professional provider client care setting, what are people doing well? What kind of progress are they making? How are they improving? And what might they do more or different? What might they stop doing? Now, when we deliver a presentation, right, aren't we doing something, in fact, a little similar? Because in a presentation, we're telling a story. We tell a story with a problem, a complication, a question to be answered, and a solution. We describe what happened. We describe the outcome. We try to provide clear and convincing evidence, rich examples. And a presentation inevitably has some kind of call to action, right? What are you compelling the listener that you want the listener to now go do, or to think, or to reflect on? In your reading, you have one model called BET. So one form of feedback is to very concretely describe the behavior, what the team member is doing that's valuable. Why is it valuable? Why it matters. The effect of that behavior. How does it contribute to the result, the outcome? Or you as a doctor, when you say to a patient, you've lost 25 pounds, and look at how your A1C numbers have improved. That's fantastic. Good for you. Right? And we always want to show appreciation. Thank you. Again, what's more fulfilling as a healthcare provider when you see somebody make progress? You're thanking them for their own initiative. You're also being appreciative that they've listened to your advice. Isn't that a human being thing to do? Is that any different than what we do when we are taking an employee or an intern or an assistant physical therapist or somebody who's training to become a pharmacist, and you say, good job, thank you. So that's a nice little handy part of your reading that I think the acronym's useful. To give feedback is to make a bet. Observe the behavior, observe the effect, and to be appreciative. Now, your text also talks about another kind of feedback, what's called the bear model. So the bear model comes down to it's time for constructive feedback. I have to criticize. I've got to observe something that's not right, and I want to provide some type of corrective action. So what are you doing? What kind of behavior that you're doing that's unacceptable, or what are you not doing as a result of that that's unacceptable? For you attendings, if you have a first-year resident and you're going on rounds and they left out an important piece of information, you're probably going to correct that on the spot, are you not? So what's the effect of that performance? Why is that performance unacceptable? Why does it matter? Because if I'm going to accept constructive feedback from you and I'm going to change my behavior, it has to matter beyond just I said so. So as a presenter and as a professional communicator, the impact of that behavior and why that behavior has to change is an important thing to signal in interpersonal communication, is it not? And do you have something you want somebody to do instead? What direction are you going to point them in? Where do you want them to go next? So what's the alternative that you're seeking that they do? If that A1C is still climbing, all right, we got to do an intervention. I need you to keep a 7-day diary, and I want you to write down every spoonful of food that goes into your mouth. Results. What will happen? What are the consequences of not changing? I think in the case of diabetes, it's pretty clear what will happen. So if that A1C continues to climb, we all know about neuropathy, we all know about blindness, we all know about continued weight gain, we all know about early complications that lead to mortality and morbidity. But let's talk about the workplace. Let's just talk about if somebody doesn't get their work done by 5 o'clock on a Friday, and we need to have that done by Monday, what's the impact of that work not being done? So if I'm trying to provide a correction, right, I need people to know the consequences of not acting. And those consequences, they are whatever they are, but I have to communicate them clearly and firmly. Now, last week, we discussed and introduced kinesics just to put a language over what we talked about in session 5. So we added gestures as emblems, illustrators, regulators, and adapters. We also talked about eye contact, facial expressions, posture, and body movement. I want you now to test yourself on the quiz that starts on page 21 of the assigned readings for this week. It's actually listed on page 81 in the chapter. So you get both the test and then you get the results of how do you gain insight into the role of interpersonal communications. And I'm going to give just 3 examples here. What is the meaning of palm to cheek? Right? So you know that a palm to cheek generally means sincerity. What is the meaning of a thumb under the chin? The thumb under the chin indicates more of a critical judgment or possibly a negative attitude. So those are 2 of the 8 that I invite you to go look at now if you haven't had a chance to do that, and then come back. So to continue in our conversation, let's talk about another part of kinesics, but let's talk about what we call proxemics, which is the use of space. There's an intimate zone, a personal zone, a social zone, and a public zone. It's important that we understand in different cultures, we view intimate, personal, and social zones differently. So for those of us who are Western European, who might be of an Irish, British, Scottish heritage, or Canadian, English Canadian, generally North American, intimate zone for us is you better be family if you get close in that space, or I better have given you permission to get close in that space. A personal zone is fine if we've established a boundary that indicates that between 1 and 4 feet, between 1.5 and 4 feet, it's okay for that to be that close to me. If you're a stranger, please don't. Elsewhere in the world, other cultures, strangers feel pretty comfortable getting between that 1.5 to 4 feet space. You will certainly find that as you travel in the Middle East, and you will certainly find that as you travel across some of the Asian countries. Certainly not all of the Asian countries. I don't want to overly generalize. So it's, again, as a presenter, as a communicator, in terms of interpersonal communication, we deal with different cultures. It's important to know what has us comfortable according to the rules of my familiarity with you. So the last thing I want to touch on for this part of the pre-class lecture, before we'll take a pause and we'll pick it up in a few minutes, is strategies for nonverbal communication. So I think it's important that we mirror the other person, because mirroring the other person is not just virtue signaling, but it's emotional and social contagion saying that I get you and that I'm in and sharing that space with you. If somebody indicates that they want a 4-foot distance, you give them a 4-foot distance. If somebody has an arms crossed, you may initially cross your arms. You may then open your arms, which allows them to potentially feel more comfortable dropping their arms. Again, this is very much one-on-one. In a larger presentation context, I might make a little bit more eye contact with somebody who's got their arms crossed, just to let them know that I see them. I might smile at them. I may check in with them and say, how are you doing? Are you doing okay? Is there something I'd like to invite you into the conversation? What are you thinking right now? because it's a disarming technique that registers, I've mirrored you, I've seen you, I've heard you, and now I'm nudging you. I want to kind of move you into maybe a slightly different space. But by all means, make sure that your nonverbal cues match what you say. If I invite you to the conversation and I'm doing this, that's very different type of signal than I'm inviting you to come into the conversation. So make clear and purposeful what we're doing in our body to have it match what we intend to communicate with our words. Do pay attention to your nervous habits. We all have them. You've seen them now for me. So we all have our tells. What makes us a little bit more uncomfortable? What makes us a little bit anxious? I think it's very important that you practice the gestures you want to make when you make important points, as I do when I practice before I do these pre-class recordings. I think it's important that we do pay attention to what's going on in our body. What are emotions? Because those emotions are going to leak out and ultimately register in micro-expressions on our face or in our body. We're going to signal what we're feeling. So we need to pay attention to that. And we need to find a way that if we have emotions that are going to disrupt or to be negative towards what we're trying to accomplish in communication, then we have to find a way to bring ourselves back to center so that we can be purposeful and positive in what we're communicating, even when that's a difficult or hard to hear message. And by all means, finally, we are obliged to use vocal control, as we talked about in weeks 2 and 3. So I want you now to stay tuned because there's more to come.